Hello everyone, and welcome to this webinar on behalf of the IANPHI Europe Network. My name is Trygve Ottersen. I'm the Director of Infection Control at the Norwegian Institute of Public Health, and also the chair now of the European network of IANPHI. And we have this webinar series where this webinar is part and the final webinar for this year. We are very pleased that we are able to have this webinar with the great panel we have, and that you are and that all of you are participating. So why have a webinar like this on the pressing strategic choices for national public health institutes, and why now? The background is really discussions we had this spring. The world is changing, obviously, over the last few years. The COVID-19 pandemic, for one thing, conflict in Europe and beyond, and also other challenges that are new or emerging and growing bigger in scope and magnitude. So the world around national public health institutes are changing, and many institutes are both in the process of making changes from within, but also having their premises, so to speak, being changed from outside, sometimes driven by the experiences in the country from the COVID-19 pandemic, partly for other reasons. So at least our experience from the point of view of IANPHI Europe is that very many national public health institutes at the moment is grappling with some big strategic choices and are in the process of developing their strategy. So against that background, we thought it would be useful, at least we hope for many, to hear from the different institutes. What are they dealing with now? What do they think, or for them, is the top 5 or top strategic choices or questions that are facing them at the moment? So to better understand that and to share those experiences and views, we did a survey of where we got input from several national public health institutes in the spring. We discussed this in the annual meeting of IANPHI Europe in April, and we have got some further inputs also after that. This webinar is really the last bit of that process, where we will discuss the findings before we summarize both the findings and your perspectives and discussions today in a brief note that we plan to share across the IANPHI network. So today, the plan is really to share the findings from the survey, and then to discuss from multiple perspectives, both those findings, but also what are the top strategic choices facing the speakers and the countries of the speakers on the panel. So while the survey was based and focused on Europe, we have invited speakers here from panelists from other regions, both to get the view from the outside on Europe, but also, of course, to learn how the situation is outside Europe, and really to make this webinar, we hope, relevant for the whole of IANPHI, and not only IANPHI Europe. So that's the goal. And the agenda is quite simple. We will start with hearing from Bjørn Iversen about the findings from the survey. Then we will have the perspectives and views from 4 panelists before we move into a Q&A or discussion. And I really hope that all of you will both consider to type in comments, questions in the chat on the way, but also in the Q&A session. And please both share your own experiences or post questions or comments to what is being said. The plan, as I said, is simply to learn from each other, to better understand our own challenges by hearing from others. And that's very much, of course, in the spirit of what IANPHI and the networks are for. So before we start, just some housekeeping. First of all, the webinar is being recorded. So that means, for one thing, that it will also be uploaded on the IANPHI website, and you can look at it later or share it. But also be aware then that what you say will then be recorded and be publicly available. It's automated captioning in English is available for this session. And as I mentioned, please feel free to use the chat for any kind of input, really. And in the Q&A also, it would be really good if some of you also want to take the floor and raise some topics. So then, before further points from my side, let's begin with the survey results, and over to Bjørn Iversen, who's the senior medical officer here at the Norwegian Institute of Public Health, and also the key focal point for our institute in the interaction with IANPHI. And then he's been the driving force behind this survey. So over to you, Bjørn.
Thank you very much, Trygve. And it's a pleasure for me to show this to you, the inputs from the survey that we presented and discussed in Portugal in April this year. And if I can, let's see, yeah. One input, or one reason why we started this was that so many of the national public health institutes said that, especially post-COVID, that the times are changing, and we would like to hear from each other, learn from each other, share experiences, and that's why we decided to make this survey. I should also mention right now that a large document by WHO that is being co-published by WHO and us on the essential public health functions are also important for public health institutes to see what is their role among all the public health essential public health functions. So the goal is to gather information for the most pressing strategic choices, and we sent a survey to the European members, and before the European network meeting in Portugal, we received 12 replies from 12 Public Health Institute members of IANPHI in Europe, and afterwards 2 more. And these are the names and the countries that participated in the survey, but I'm not showing any country-specific results. First, we asked, do you have an ongoing strategic development process? Of the 14 who replied, 12 said yes. Only one said that they didn't have an ongoing strategy process, and one didn't answer that question. We both asked what triggered the revision of the strategy, and then also what were the drivers during the strategy revision process. The answers are a bit overlapping, but we will show them separate. And behind very much of this, it's the pandemic. The lessons learned from the pandemic, and many of the other thematic areas that triggered the revision are also based on what happened during the pandemic. For example, the financial issues. Many of the public health institutes have increased budgets during the pandemic, and to the varying degree had budget cuts that necessitated a revision of the strategy. Then from the political side, many governments then started, hey, we have learned so much, we need to look at the structure of public health functions in our country. Internal factors also came up, and several public health institutes have a routine to update every so often. their strategy. Changes in society, not necessarily the pandemic, the global situation and social determinants of health. Climate and health comes up again, that as an important trigger factor. That we just heard yesterday that October was the warmest October ever recorded. So there are other issues also than the pandemic, and then some other issues as well. Like one public health institute said that the government sensed an increased risk of bioterrorism that necessitated change. And what were driving the revision of the strategy? Again, pandemic, reorientation, budget cuts, some of the same issues that drove or triggered the revision. And then many political signals. In many countries, the government started to reorganize, to see that we need to collaborate more, both across sectors and so on. Many countries have laws that concerned public health institutes that wasn't updated during the pandemic. Some got new tasks and mandates and so on. And a recurring item here is the political threat to independence. Some countries, the public health institutes were not allowed to voice their opinion or the knowledge that they had. Internal factors, again, to reformulate as a consequence of the pandemic, changes in society and health, climate change, and one important area that came up was technical issues, that we need the availability of new types of data, collecting information, health information and other information from a variety of sources, improved technological development, artificial intelligence, the need to combine different registries and so on, and the legal system or the laws for surveillance need updating. Then, as part of this independence or dependence on the government, we asked who are in charge of the strategy process. And most of the public health institutes answering, saying that they are in charge of the strategy process, but for many countries it needs to be approved by either the Ministry of Health or other governmental authority. Very few said that it was the government or the Ministry of Health that did and was in charge of the strategy process. And also regarding the, let me see, the autonomy to make strategic choices, it shows that it's a balance. Many are do have the autonomy to make strategic choices, but for many, the government has an influence on it. So then the strategic choices. We asked, what do you consider the top 5 strategic questions facing your public health institute today, whose answers are critical for the future of the institute? And we set this in a time frame of 2 to 5 years. And even though we asked for the questions they asked, it was difficult for many of the responders just to say questions, because they also gave topics. So there were questions on policy. Why are we here? How can we work together? How can we communicate? And the optimal division of roles and tasks between the public health institutes and other stakeholders, and that will be interesting also to see for the implementation of the essential public health functions, and working across. Looking at questions about the optimal way of financing national public health institutes, and the role of the public health institutes, the key challenges and opportunities, and again, as many experiences during the pandemic, how can we best secure our scientific independence? Technical and tasks questions, how best we can adopt and utilize the advanced data and technology, where to focus, how can we do more in the future when all that we learned, how to respond to new threats, climate change most pressing, and other questions during the technical part. And several also listed how to ensure the best quality with the workforce we have. How can we utilize our workforce to be the best and to use them so that the output of the National Public Health Institute is optimal? And also how to measure the effect and impact. And then many listed various tasks that they would need to prioritize. And as you can see from this list, there are too many issues that are so important for public health that we need to prioritize. And at least from my perspective, trying to analyze, it was clear to see that it's difficult really not to list everything. But it's a good exercise to have. Organization of public health, including the roles of national public health institutes, because there are many other stakeholders in the country who are responsible for public health. So networking for public health issues across country and outside of the country, promote the core values, again, scientific independence. What are the uniqueness, what is the uniqueness of Public Health Institute, and how to have a proper distance when you work closely with the politicians as in an emergency. To work more closely with stakeholders, citizen involvement, many listed, and how to avoid conflict of interest, improve diversity and inclusion, and so on. I will not go through them all. Human resources and workforce, how to utilize, again, the human resources, how to make them the most skillful, how to attract the best people, and so on, and how to train and update the knowledge of the workforce. Many listed also the social factors, determinants of health, and IANPHI has a committee working on equity and inequalities. And as we have seen during the pandemic, the weakest in society are always hit the hardest. So, and the commercial determinants of health, impact on public health measures, and so on. So there were quite a few factors on social factors and determinants of health. Many, again, listed on technologies and digitalization, and it's definitely certain for our institute that really would like to work to improve many of the technical skills and improve surveillance systems at our institute. Health security and surveillance, the multidimensional surveillance will focus both on warning and prevention. How to shift from cure to prevention was something some mentioned, and the scientific knowledge based also in an emergency, which is really when we don't have that knowledge. and how to access resources for resilience and adequate robustness. And the last here is health economy and financing, relationship and sustainability for that. More focus on the research and the financial support for research, and a few other issues: crisis management, global health, internationalization, communication. And I would like to end with a favorite film of mine, The Wizard of Oz, where Dorothy, and being a friend of Dorothy's, with her friends, going to down the yellow brick road to find the wizard who can tell them how to get courage, how to get the brain, how to get the heart. And one of the morals of this movie is that the wizard, he doesn't have the answers. The answers we have ourselves. So by this seminar and by talking to each other, we will find the answers that are right to us. We shouldn't ask the wizard, because we are the ones who know. Thank you.
Thank you very much, Björn. A really broad overview, as you all can see. It can be overwhelming, of course, but I think it's interesting both to see the similarities or the convergence in certain terms, but also that there is so much variation, really, also such a range in the way that institutes answer the question about their top 5 pressing choices. So that might, of course, be that we understand the questions differently, but also that we are in quite some different situations, and hopefully we can learn it from each other either way, as Björn and the wizard story tells us. So so then we will go over to our panel, and we've been so lucky to have 4 great panelists representing different regions. And we will start, since this is a kind of Eurocentric project to begin with, we will keep up with that, at least in the first part of the webinar, and start with an complementary or additional perspective from Europe, and Montenegro in this case, with Dr. Igor Galic, who's the director of the Institute of Public Health in Montenegro, and also, by the way, is the host of the next annual meeting of the IANPHI Europe Network. So over to you, Igor.
Thank you, Björn. Thank you, Mr. Ottersen. Dear colleagues, first of all, I would like to thank the organizer of this meeting, as well as all panelists and those who follow this meeting. The challenges posed by the COVID-19 pandemic to all of us are maybe the greatest in modern history. The efforts on a professional and a personal level were immeasurable. And as it was said at the beginning of this terrible emergency situation, the pandemic has opened fractures in society, the family, and the individual level. It is up to us to use all our knowledge and experience to improve the overall health system and then the public health system. In this sense, the extent of the Institute of Public Health and organized public health response provide to be crucially important. Therefore, the importance of the Institute of Public Health for society and the state should be constantly emphasized to decision makers. Given that next year Montenegro will host the annual meeting of the European unit of IANPHI Network, a series of bilateral meetings and visits to the countries and the Institute of the Western Balkans and so East Europe were held. During those meetings, as a conclusion, a number of problems were presented, the solution of which is necessary for the further survival and development of institutes of public health in the whole region. Sustainability is essentially, namely a large number of institutes, even they are celebrating 100 years of existence, face the problem of stable financing, since they are not recognized by the governments of their countries as a budget beneficiaries. So they are financed mainly through projects. Considering the importance of both microbiological and biochemical laboratory diagnostics, especially in terms of disease prevention, it is hard to understand this kind of step-motherly relationship of most states. Stable funding over a long period of time is the basis for the further development of every institution, including the institute. The next important point is human resource. We are facing the problem of young and the new personnel. A large number of young people are not interested to study medical science, especially in the field of public health, as materially unattractive. In cooperation with the states, a model would have to be found to solve this problem. Only after solving these basic problems, further strategic development could be considered. IPH should be the barriers of the development of preventive programs and the response to emergency situation in public health. In this sense, Institute of Public Health of Montenegro, in cooperation with the Ministry of Health and with the donation from the European Union, started the constructing building of Public Health Emergency Operating Center, which will be finished till the end this year, which in the future will have the role of coordination, data collection, analysis, and projection of the situation related to the prevention and control of infection disease, especially pandemics. Digitalization on the entire system is one of the most important elements of the Public Health Emergency Operating Center. IPH is one of the partners in the One Health concept. In the future, climate change will cause the spread of vector-borne disease, which will cause higher of infection disease pandemics, and therefore the extent of IPH will be extremely significant. In addition, we are today in the center of pandemic of non-communicable disease, and through the extent of registers or certain non-communicable disease, as well as the screening programs coordinated by the institutes, their importance in the health system is increasing. It is the mandate of IPH to provide professional and technical support to the Ministry of Health of their countries, especially in development of various strategies, which can directly influence the development of strategies in direction of the public health and institutions that will support it. The final goals of IPH as a professional institution is independence from the great influence of politics, with which they should certainly remain very close partners. So this is the mainly goals in our region, Western Balkan. Situation is Montenegro is some different because our government support us as a budget partnership with almost the whole budget, but the main number of institutes in region, especially in sub-regional level, are not supported from their government. It is very important because that sub-regional institutions are members of whole one unique network of institutions, which the main goal is prevention, control disease, communicable and non-communicable disease. So it is very important, as I said, this is goals from this part world.
Thank you very much, Igor, and very useful and interesting also to have your perspective on the big challenges also from you in Montenegro. We will then move away from Europe, so to speak, and to Canada, which, by the way, is actually a member of IANPHI Europe, and we're very happy that you are, Teresa. So now we will hear from Dr. Teresa Tam, who is the Chief Public Health Officer at the Public Health Agency of Canada, and I'm very much looking forward to hear what you think in this space.
Thank you so much, and it's great to be here, and it's very opportune for us to have this discussion because the Public Health Agency of Canada is embarking on a process of renewal as well. So our agency was born after SARS in 2004, so we became kind of an adult during the pandemic of COVID-19. We report directly to the Minister of Health, and we have a president of the Public Health Agency of Canada who is not a public health expert, while I am the lead public health professional for the Government of Canada. While we report to our political decision makers, I personally can communicate directly to the public and publish independent reports. We have, broadly speaking, maintained all of our existing mandates from health prevention of disease and injuries, health protection, and health promotion. And I certainly believe that it's important to maintain the whole suite of our core public health functions in moving forwards. We, as I said, are embarking on a renewal journey. We will have a new agency strategic plan, which is developed by our own agency. And as a result of the need to, again, like many other NPHIs, renew our vision, our values, we really have to be an excellent science-based, data-driven organization with equity as our core. So we'll be thinking through all those different core values and what we do going forwards. But of course, we are doing this as in terms of having to incorporate all of the lessons learned from the COVID-19 pandemic and also address threats such as AMR and climate change. We have a big crisis of illicit toxic drugs that is causing a huge number of mortality and morbidity in young adults, especially men. And of course, like others, we have demographic shifts and technological changes, as well as dealing with the misinformation and disinformation landscape. We also have to deal with quite a number of audits that have come our way during the pandemic and have to deliver on some of those recommendations. Another key aspect of the shift going forwards is that during the pandemic, we grew quite quickly in size, had new branches, but a lot of our escalation was because of a massive operational footprint that we had to scale up. That included border health services. We have a national emergency strategic stockpile that we need to look at what we do with that in the path forwards. Vaccine logistics, massive program, and providing surge capacity to our provinces and territories in our federated approach to health. And so we have to land on a sustainable approach going forwards that also allows us to really rapidly flex and scale. So how do we set things up in order to do that is actually a key question. And in the context of a great need in the health system, particularly healthcare system, the public health needs to make our case as usual. They've, beginning to forget the important role of public health. So how do we make ourselves relevant and ensure that people understand that we cannot have a sustainable healthcare system without a good public health system? Some of our top strategic questions or choices, I might only focus on a few of them, but one is how do we strengthen our science and evidence to policy and practice continuum, if you like, from knowledge generation to action. And this is also linked to the need to continue to build trust with our public in the context of a general negative trend in the trust for governments, for science, and public health. And so there is a review of pandemic science advice and research coordination underway right now. So we will have to sort of take into account that process. And we would love to learn from other institutions about best practices for that science advice mechanism and how to integrate that science into policy and practice. During the pandemic, we had to stand up a lot of ad hoc expert committees. And so how do we develop rosters of experts, and how do we maintain some of these during peacetime, but escalate some during emergency would be important for us to land on. And we are also developing our inaugural agency science strategic plan, which is led by our chief science officer. And we would certainly love to talk to IANPHI about this initiative as we move ahead. And so basically, in the end, we needed to sort of think through how we enhance access to and ability to use and translate high quality science and communicate that to the public in a credible manner and build trust. So second key area for challenge or questioning is, like many of you just said, is strengthening our data, surveillance, laboratory infrastructure. A lot of that actually is how do we sustain some of the gains that we had during the pandemic and moving forwards. We had a lot of investments in new systems and platforms that ranges from genomics and wastewater surveillance to some new data pipelines, and a new Center for Integrated Risk Assessment. How do we continue to build up and not let these new infrastructures disintegrate really going forwards? We have, I would say, several decades of recommendation for how we better access data from local level up through our provinces into the national level or pan-Canadian level that have not really been fully addressed. And some of the barriers are not technical, but more political will and cultural shifts in not siloing data, but looking at more integrated surveillance. I think that's another topic that IANPHI has focused on as well. So we are currently looking at the development of a pan-Canadian health data strategy to create this world-class health data system. And that has to be linked to the digitalization of the healthcare system as well moving forwards. Just very recently, we did have the provincial, territorial, and federal health ministers agree on a path forwards. Of course, all of this has to be maintained through sufficient funding, as well as the setting up of new technical infrastructures, IT systems, as well as these networks of networks that have to be maintained going forward. So a huge amount of work in that area. Yeah, I'll just touch briefly on championing health promotion and upstream prevention. So the agency has maintained a branch that fundamentally addresses non-communicable disease by looking at the underlying risks and protective factors for chronic disease and for mental health and wellness. but we need to continue to look at how do we mobilize intersectoral, interdepartmental action to address the structural determinants, the social and economic determinants of health. What is the public health agency's role in that context? How do we get the disaggregate data, for example, that we can provide to different other government departments in order to strengthen those determinants of health? And linked to this, I would say, is an initiative to ensure that we have an equity-centered approach to emergency management, from mitigation, prevention, preparedness, response, and recovery, that focuses on community resilience and what is the agency's role in the building up of local level community resilience going forwards. And like all of you, we also have significant challenges looking at our public health workforce, which is a bit burnt out, but we'll be refreshing our public health competencies and other support mechanisms. So I'll stop there. Thank you.
Thank you very much, Dr. Tam. I think this both articulates some of the challenges we have in common, but in a slightly different way, like science to policy or the way to strengthen our data infrastructure, but also points to some challenges that at least I haven't heard so much in this process so far, like the opioid crisis and how that also is really high on your agenda at the moment. So thank you very much. We will then move on, and now we will move to Africa, the African region, and I'm happy to introduce Dr. Sofia Viegas, who is the Deputy General Director of the Mozambique National Public Health Institute. So looking very much forward to hear your views on this, Sofia. Over to you.
Thank you very much. Thank you for inviting. It's an honor to be here. Let me just check. Can you see my slides? Thank you so much. So I will talk a little bit about our experience, our challenges, and our strategic choices to strengthen the National Institute of Health of Mozambique. So INS, or the National Institute of Health of Mozambique, was established in 1955 initially, and it was known as the Mozambican Institute of Medical Research. And 2017, we have approved we were nominated as an autonomous institution, and these are our main roles in the health system in Mozambique. So it includes biomedical research, laboratory reference services, surveillance, emergency response, and health observation. Also communication, education, and training in health. And finally, public health partnerships with national and international organizations. So our challenges are pretty much aligned with the changing in the public health context in Mozambique. I've heard some challenges regarding climate change. It's not different for us. Actually, it might be maybe worse in some regions. We are facing increased frequency and severity of extreme climate changes, and those are the pictures that we chose to bring here. In 2019, just before COVID, we faced one extreme big cyclone, the Idai cyclone. Immediately after, we faced the Kenneth cyclone. There were small cyclones in between, and this year we were faced twice with the same cyclone. It was Freddy cyclone that severely affected the central region of the country. So we are also facing terrorism in the northern region of Mozambique, the province of Cabo Delgado. One province is being affected by terrorism since 2017. And this causes a migration crisis caused by these disasters and also the terrorism. We are also facing increased national and regional mobility. And finally, the rapid growth of the Mozambican population. We are now around 34 million, and we are increasing like 1 million per year. So we are facing a really rapid growth of the Mozambican population. In terms of changing the institutional context of the Mozambican National Public Health Institute, so our rapid growth is also part of our challenge. With the COVID, we could rapidly establish public health labs in every province of the country. We also rapidly established disease sentinel surveillance for vaccine preventable diseases, zoonotic diseases, pan-respiratory diseases, and we have also established a community mortality surveillance. Our staff at INS have grown from around 300 in 2016 to almost 1,000 this year. So we are also facing a really rapid growth of the workforce at INS. And our mandate have also expanded to outbreak investigation, graduated training. And this is also aligned with the new legal framework. This is also, sorry, I didn't mention the surveys that we have to conduct. So we are responsible to conduct all large surveys in the country, like the HIV surveys, malaria surveys, TB surveys. And we also coordinate the field epidemiology training program and other post-graduation programs. And this is aligned with the new legal framework of the National Public Health Institute that was defined by the Biomedical Research Act. So, although we have faced this rapid growth in the technical and in the scientific areas, we are facing a lot of challenges in the admin and the management areas. And this can clearly be seen in the evaluation of the INS scientific strategy. So our strategic plan is a 10 years strategy, and we call it scientific strategy. And among all the main areas, the admin and management have shown a lower progress. This is demonstrated by the effort that we made in the technical and scientific capacities. So we made a lot of efforts. We managed to accredit 25 lab tests. We managed to establish these new labs. We have increased the number of surveys. We are the co-leaders in the rapid response emergency group. So we have gained a lot in the technical and the scientific capacities, but we didn't make enough effort in the management capacities. And this is somehow limiting our ability to really accomplish our goals in the technical and in the scientific areas. So this is our main focus now. And this is what I brought. So our main focus is really to focus in these 5 pillars. in the admin and management areas. And those pillars, they includes the organizational structure, the financial management, the workforce development, the quality management system, and the fifth pillar is the institutional self-sustainability. So I will talk a little bit of each one of those. So our statute was approved in 2018, the one that is in place now. And in this statute, we didn't have like a directorate for admin and finances. And to make it robust, we decided to really establish this as a national directorate, so we can have enough power to deal with all the challenges that we face. So in the revision that we need to submit and to be approved by the Board of Ministers, we want to create a national directorate for administration, finances, and human resources. We also want to create a legal office to make sure that we follow all the legal processes and requirements. We do have lawyers, but creating a legal office will make it more feasible to operate. We also want to establish a department of acquisition and IT. These were previous units. So these are areas that we really want to focus on in the next years, and create an office for the Director General to support all the admin processes that passes through the General Director. The second pillar related to the administration and financial management, our main outcome is to increase the institutional capacity to adequately manage external funds. So the number of projects that we are dealing with is increasing time by time. Now we have around 60 research projects in place, research and institutional projects. And the management of those grants and those projects is a challenge. So we want to develop a plan to strengthen the financial management in the context of growth and diversification of financial streams. We also want to restructure and expand the project management unit. There is a project management unit at INS, but we want to make it more broad. We want to include searching for grant opportunities, supporting the researchers to write a grant, to make it strong, to be founded. We also want to expand electronic systems in the financial area, but not only in many other admin areas. This is the digital transition in all management operations. That's why we also need an IT department. The pillar 3 is workforce development, and our main outcome is INS with efficiency in attracting and retaining the adequate human capital. So we have, as I shown, we are around 1,000 now, but we are a state institution. So our salaries cannot be compared with salaries from an NGO or from the private sector. So we need to find strategies really to retain the human resources. And this includes a plan to improve the organizational climate and develop a strategy for talent identification, development, and retention. What happens is that we train the people. They have the master's and PhD degrees, and after that they leave the institution to other places where they can receive a better salary. The fourth pillar is strengthening the quality management system. The picture on your right is one of the moments. It's a symbolic moment with the previous Minister of Health. So in this picture on your left is the previous minister, and on your right is our previous General Director. Now he is the Vice Minister of Health. Here this is a symbolic moment where we wanted to show, to demonstrate the certification or the accreditation of one of our lab tests. So although we had this improvement in the labs, in the technical areas, we still need to focus in the management area for quality systems. And our aim is to ISO 9111 certification of at least 2 processes in the administration. And for that, we need to increase the efficiency of the quality management systems. We need to improve timeliness of the admin processes. We need to make sure we have audits and continuous monitoring. We also need technical support for that. So finally, our pillar 5, that is building institutional self-sustainability. So I brought this map. This is a map of Mozambique, where we show our representation in every province. And this is just to demonstrate how broad we are in terms of representation in the country. But this is also a huge challenge in terms of maintaining the infrastructure, running costs. We have some support from the state budget, but it's not enough. So we really need to build a self-sustainability strategy. So for this pillar, our main outcome is to enhance institutional capacity to self-generate incomes and reduce operational costs through efficiencies. And so for that, we need to establish a formal business plan and also a self-sustainability strategy. So thank you. I shared some of our strategies to strengthen and to overcome our challenges. This picture on the background is, you cannot really see, but well, it's our public health institute in the district of Marraquene. It is a little bit far from the capital, but it was inaugurated in 2018, and it's our headquarters. Thank you very much.
Thank you very much, Dr. Vegas. And I think many of our institutes experienced kind of growth pains during the pandemic, but the magnitude and the way you did it, I think is unparalleled, or at least quite different from what many of us others have experienced. And also you point to an issue that already have come up in the chat, and we can revisit later, about the workforce. And you pointed there to a strategy. I don't know if it's underway or already developed, but let's come back to that in the Q&A. And please, everyone, feel free to both raise issues or pose questions in the chat, and we will soon get to the discussion. But last but not least, we will hear from the Asia region and Professor Amar Ikram, who is the former CEO of the National Institute of Health Pakistan. And he is also a member of the executive board and been very much involved in IANPHI for a long time. A member of the board, I should say, together with another panelist here, Dr. Tam. I forgot to say that. So thank you very much, Amar, for joining the panel, and over to you. We cannot hear you now.
I'm just putting up my presentation. Just give me a minute. Can you see it now?
Yep.
Okay, thank you so much, I think, for providing this opportunity. It's really grateful what you're doing in the EU. And as we say, one size may not fit all, but I'm sure the outcome of your surveys and that can be channelized and make more meaningful for the other regions as well. Coming back, I think this is the best time as we have just come out of the COVID and a great experience that has been there. And for years, we have been talking of great eventuality, and we never knew it came in the form of coronavirus. And but it did bring many opportunities, and I think from there we can move on. So my own question I always ask and tell the people, why are we concerned about this thing? Because we have this emergence and re-emergence of infectious diseases, serious and unusual diseases, events may occur, threat of deliberate use. Some of the participants have already talked about a little bit, mentioned that, and then the laboratory and industrial accident, and in turn, its impact on health and economy. And just COVID has had an impact of $16 trillion, which is huge. So the globalization, I think, something very, very important, because a threat anywhere could be a threat everywhere within no time. Now, I just go back to some of the challenges that we had at the national level and how we overcame those during the COVID crisis. First of all, I think the best step was establishing a national command and operations center, bringing all the stakeholders together, all the national institute, the provincial and regional, and then moving on to institutes like Disaster Management Authority and the NPHI, the National Institute of Health in Pakistan. And along with that were the private and public sectors. Setting out appropriate strategies, which are centralized and monitored and implemented wholeheartedly across the countries. And similarly, the disease system we established in the very early days, the system of smart lockdown. We never underwent complete lockdown after the first lockdown, because definitely we are developing countries and we have to take care of the masses, a population burden of almost 250 million. So we adopted the technique of smart lockdown, and that worked very well. And then the diagnostics, availability of treatment and vaccination and so on, and all worked very well. Now, all this, the National Command Operations Center has been made now part and parcel of the NPHI, and it is functional within the CDC of NIH till today and working very well. Just, during the first two waves, our response were very well appreciated. And I would like you to show some of the certain slides in the just 1 year of COVID, whereby talking of latest testing data from the country in the region. Pakistan was launching the data on the very first day once it was received. And similarly, in the countries, you can see the dark green areas where we can see the different countries which have been doing. And this definitely improved as we moved on. We established the first ever national data center at the National Institute of Health. And now it is not only that, the only public health institutes having its own hub and servers, but also taking care of the registries, disease registries as well. We fully activated the CDC under the umbrella of National Institute of Health. And I think we have been the pioneers among launching the integrated disease surveillance and response. Even before COVID, for almost more than 2 years, we've been working on that, and it became fully active during this difficult situation of COVID. And then the utilization of it, we had a good number of field epidemiology trained public health force, which was utilized. And finally, the good thing is that the government has taken over all these things and the financing is coming from the government side. So this was the TTQ, the testing, tracing, and tracking, and finally the monitoring. Based upon that, we used to pick up the hotspots and move on, and this worked very well. And this will definitely, all these things have been now under the NPHI umbrella, fully functional. Now, if we see in the region for the contact tracing, again, in our own country, we did very well. It was a very comprehensive sort of contact tracing during the initial period, which followed throughout the COVID crisis. And that gave a lot of learning, which continues even with the next crisis that I'll talk about to you. But you can see the different regional countries where definitely it was not that comprehensive. And those are the countries, especially our neighboring country in Afghanistan, which need more to pick up in this regard. We upscaled the diagnostics, we established the PCR labs throughout the country, and not only that, we were very keen to maintain the lab biosafety measures along with the quality assured results. And for that, we conducted trainings throughout the country, even during the crisis time, and there was not even a single outbreak of COVID within any of the labs. So we started off, as you can see, with the provincial and federal public health labs. But as we moved on, we kept, I think, increasing the number of labs that could do the PCR even in the far-flung areas at the border areas. We managed to have mobile labs that function very well. So if the testing, you can see, I mean, we again had a very comprehensive, and anyone with the symptom was tested. And I think most of the regional countries in Asia also did well in this regard. We established the Genomics Center. There was none at the national level at that time. And under the umbrella, we brought in the public and private institutes and academia, and it is functional. And that's, I think, we gained the momentum. We established a state-of-the-art hospital in the federal area, beside definitely having isolation and other facilities within all tertiary and secondary care hospitals. We had laid down a very comprehensive strategy for vaccine even before it was available. For the first time, a national immunization management system was formed before even the availability of the vaccine. Then the procurement followed, and then we moved on. And side by side, we were very keen for the transfer of technology. We did manufacture 20 million doses at NIH because one of the key mandates for is vaccine and biological manufacturing for the NPHI as well. So we kept moving during those crisis time and pick up this challenge. And we were also selected for the messenger RNA technology transfer, which is again a great success indicator. I think artificial intelligence has been a huge utilization, but I think with the telemedicine, we were again leading in the world. Then we started much earlier and kept moving on. For the COVID R&D and just for the NIH, we have got more than 80 peer-reviewed publications. We started off with the clinical trial. And I think the foremost country that we started working on environmental surveillance, the sewage sample, because we were already testing the polio, but we increased the size and we started monitoring with the molecular studies for COVID in the wastewater as well. The success indicators, I mean, I think during this crisis period, Pakistan managed not only to become the part of the GHS's steering group, but for the last 1 year, we are chairing. We have international recognition for our IDSR system. I think another huge credit that goes to IANPHI is the peer-to-peer review. And I'm being part of IANPHI, and now we talk from the, this is an area where we can move forward, because if you see the joint external evaluation, the new template for that as well, I think IANPHI peer-to-peer review could be very meaningful. And that's what we've underwent very early. And similarly, for the joint external evaluation, we were the first country in the region in 2016 to undergo that. And recently, we have rerun that. And that all brings in, again, the gaps where we can serve. So what are the challenges that NPHI is least prepared? If we talk in particular to our own NPI, I think climate change and environmental hazards. I think this is a key area. We have heard from the participants, and we need to be precisely focused for the next challenges. I think this is one of the topmost priority. I mean, we can talk of EMA, we talk of so many other things, but I think so many things are directly related to climate change in turn. And then the financial sustenance. For certain things, we have managed the governmental funding, but for the rest, definitely as we move on, this is a key area. And finally, the consistent political commitment and backing, that has to be there as institutes have to progress. And one thing that our institute achieved as a result of strategic vision, I think the performance and delivery, that was very well observed during the COVID crisis. And if we see in terms of a larger perspective of IDSR, One Health, biosafety and biosecurity, global health security agenda, I think we have performed very well at the national level and at the regional level, and even we have had appreciation at the global level. And why I say so, because immediately whilst we were coming out of the COVID crisis, there was huge flooding in the country. Greater than 30% of the land remained underwater, and 33 million people were displaced, which is a huge amount. So the system was hugely challenged. But I think NIH again, NPHI came again forward with the expectations of the people. It performed, and that was the reason that we could avoid the outbreaks. We could help the people in far-flung areas and definitely capture the sea. I think some of the 5 top strategic tasks that what I think coming out of the COVID, immediately monkeypox, so many other crises. I think health security is a global business now. And that's the biggest channel where we need to combine our hands together, work together. And what we need is a trained human resource. We have already heard from the participant. And more important is the retention. That is the government job. The way they can do it, they must do it. And consistent implementable policy. You see, at the time, what we've seen in the developing country, you can make very good policies, but it's the implementation that is much more important. So all the stakeholders have to come and join hands together to make them implementable all across the country. And talking in terms of advanced technologies, I think these are the areas where we, at the regional level, at the national level, we need to look into it, how to keep managing for getting these advanced technologies in the developing countries. And finally, the regional collaboration. That is, again, very, very important. So just to conclude, that the pandemic did provide a great chance to rethink about the strategies. And that's why we are sitting. That's why you're conducting so many surveys. That's why we are trying to gather the momentum and learn from others' experience as well. So the synergy could be driven through all stakeholders, bringing the strengths together. And in our country, the ministry is overall in charge. And definitely autonomy is something that is very, very important for the institutes. The success from all this, what I've said, needs to be translated into meaningful action for the future. I want to share that on the 15th of November, this book is being launched, Modernizing Global Health Security to Prevent, Detect, and Respond, coming out of the Emory University. I am fortunately among the authors as well as among the editors. It contains 27 chapters and is all case-based and so many other studies. And I'm sure this will work very well with most of the things. So just to come to the end, we have huge challenges. And what we need is to maintain that intricate balance between the challenges and opportunities in order to eradicate and get hold of any nuisance that can come across. So if you see in the dark, you can't see what's there. Even if a portion is visible on the screen, you may not be able to make it what it is till this time you see it in entirety. And that is nothing. This is our Mother Earth. And let's join hands together to make it a much more safer and healthier world. Thank you so much.
Thank you very much, Dr. Ikram, and both for sharing all your achievement and work during the pandemic, but also the very important issues now about what are the challenges now for you, and not at least how to sustain the improvements and what was built up during the pandemic. So that's a recurring theme that I hope to come back to the panel quite shortly. But first, thank you all, and I thought we will comment, or you will get the opportunity to comment on each other or any reflections of what have been said. And also, I have a lot of questions I would like to discuss with the panel and everyone here. But let's start with the question in the chat about the workforce, because I think all of you, it was part of the survey, and all of you mentioned it in one way or another. I mean, we have a general, at least in many countries, there is a general challenge in terms of the direction of how the dependency ratio moves and the economic productive workforce versus people dependent on that workforce. So we have that general challenges many places. And then we have a challenge with the health workforce. And on top of that, in many ways, public health, at least before and now maybe after the pandemic, is not often, or always at least, the most popular or prestigious part of health and medicine. And I think some of you touched on both that, but also the salary. Public health is not usually the way to get rich if you are talented and wonder what to study and where to go even after med school. So we have those challenges, I think, in many countries, and the prestige in a way, or at least the attention, was increased during the pandemic, at least here in Norway and many other places for sure. But what do we do now? I think many of you pointed to that. So maybe to pick up then the question from Andrew Lee, what do we do now then with the challenges we all share, it seems like, but in a bit different format? And maybe I can start with you, Dr. Viegas, because I think as a pillar 3 in your work, you pointed to developing a strategy for dealing with this issue. I don't know where that is in the process, but if you can share some views and experiences, that would be great, and then we can hear from the other on the panel afterwards.
Yeah, thank you so much, and thanks for the question. Yes, there is no one solution that fits all, I think, in this area of human resources. As I mentioned, well, now we are at INS around 25 PhDs, and every year, it's true that we have 23 on training, but every year we lose like 2 PhDs. So people that are in leadership positions, they are already leading research projects, they are leading on those on a specific area, and we lose. We do have at INS a kind of how do you say, a kind of it's not scholarship, it's, you can have like a top up based on the projects that were competitive, and you could get the funds, so you can have that. But even with the top up, it's really hard to compete with the NGOs and to the private sector. So we decided now to really focus on a good research environment at INS. So make sure that everyone has opportunities, make sure that we have a good research group to work with, that people, that researchers are well engaged with the institutional vision, mission, and principles, and really try to retain based on that. We are also creating a strategy for staff retention. This is not yet written. This is in our plan for next year. So it's true that Dr. Hammer mentioned that we have many documents, many strategies, and to implement is a challenge. Yes, but it's important to have it, so at least we have a basis to work on and to get the funds and really focus on that. I think yes. So create a good environment. Have a strategy for staff retention in place. When possible, have a possibility to have a top up on top of the salary for the research projects that were gained through competitive grants. Those are some strategies that can be in place. It's easy to retain when people are on training. So when they are doing the masters and PhDs, so most of our programs are what we call sandwich programs. So they are not full-time students, so they still working while they are doing the postgraduate training. So it's easy to retain. And in principle, they are supposed to spend the same amount of time with the institution. Like after the 4 years of PhD, they are supposed to stay 4 years. And there is an agreement that they are supposed to stay 4 years. And most of them, some of them stays, but some others, they find ways to to not stay with us. And it's complicated because how can you put in the balance, like having someone there that doesn't want to stay there just because they have to accomplish the 4 years that they did on under training. So there are some challenges. There is no one solution fits all. So this is just my thoughts on this. Thank you.
Thanks, Sophia. But you got one question just now in the chat. Where do people go? I think you mentioned NGOs and the private sector, but maybe
Yes.
Katrine wonder more specifically, or is there other places as well?
No, it's basically NGOs and private sector. They go where they can get more better salaries. Yeah.
Yeah. No, great. And I think you really pointed to a menu of measures. I mean, both financially to make it more attractive, or we should say less unattractive financially to stay on board, but then also different things like just making them engage in the research group and really offering other kinds of benefits than the financial ones. So so great. I think we will just take very short also from the other panelists on the workforce, and then we will provide or ask a broader question in the end, and based on Ann-Katrine's question about what we can do together afterwards. But Dr. Ikram, I think you pointed in your end of your slides that training is one thing that might be challenging enough, but retention again, quite in line with Sophia, I think is the really big issue. So would you be willing to share what you do and what you think is the best ways to deal with that?
Thank you so for that question. I think this is something very, very important. And as you already said, COVID has brought in the importance of public health specialists at the national and even at the global and international level. So I think with all that, things are changing. But before that, I mean, coming back, I think within our own institute, what we did was, I think, a very atmosphere which was very friendly, and then moving on to celebrating the achievements of the public health specialist. And top of the list, one thing 6 years earlier, once I joined, was a missing career pattern. And we have a good number of field epidemiology trained public specialists, and the program has been going on for almost more than 15 years in the country. So with all that, I think their career pattern needed to be streamlined, and we did that amicably. And with all that, the second thing was basically the program was run by to the courtesy of CDC US for a very, very long time. So it has to be institutionalized, and that worked very well. The performance during the COVID made the government understand that they need a formal cadre, they need a formal, within the cadre, they need a formal career pattern for these healthcare workers, and then definitely owning by the government. So this is the great point, that how we could overcome this challenge within the country, and it has worked very well. Back to you. Thank you.
Thank you very much. And a very systematic approach, it sounds like. Before we turn to the big last question, can I ask also Dr. Tam, you also mentioned the workforce challenges at least one or twice. What are the most important ways to deal with it in your opinion?
I think we have to recognize public health has a very diverse workforce. And it's not the same everywhere, even within a singular organization. I think what I would add that's a little bit different to the previous speakers is actual support, mental health and other supports for the workforce itself. And we instituted something called a decompression program, for example, where people have been responding is a model taken from our defense colleagues, where if you've been on the front lines, you can't just keep going. So taking care of yourself, giving staff the time to be able to do that is really important. And mental health in the workplace, recognizing that there's many different reasons why people are burnt out. And some of us might be experiencing what we are now describing as moral injury, and on top of just simply working really hard. I think, but it is important to get the right ratio also of administrative, corporate, and project management, other supports. Because if you have all the scientists and they're not supported by anyone else, they're going to be exhausted by the administrative duties, for example. And so leveraging and making sure we're not duplicating, efforts, reduce red tape as much as possible. That's the biggest complaint. The other really important aspects of workforce strengthening is looking at equity, diversity, and inclusion. Our staff is functioning in a society where there is more tension, more divisiveness, and we can feel that in our workforce. And I think whatever we can do to engender that cohesion is important. The hybrid work arrangements have been welcomed, I would say, by the majority of staff. So there may be some flexibility in how staff can manage the family needs, as well as, of course, delivering on their work, but they have more flexibility. We have to trust our staff to be able to manage the time and be able to deliver in their own way. And so that's just slightly different input from others.
Yeah, thank you very much, Dr. Timon. I mean, you pointed to several both additional challenges, but also other ways to deal with it. And I think we could have a whole separate session on hybrid work. At least that's an ongoing discussion in our institute right now. We are very short in time, just 3 minutes left. So Igor, I will not post the question about the workforce to you. I'm sorry, but I will start with you when it comes to the final question I was planning to address to all of you, and you will then just have 30 seconds each. I was planning to ask you, not in 30 seconds, of course, but how the kind of cycle of panic and neglect are hitting your institution, including maybe lack of funding that several of you have pointed to, or less commitment or attention. But of course, we can't do that in 30 seconds. And Katrine, I think, posed a more fitting question to end on here. That's what can we do together now, beyond learning from each other, sharing experiences and ideas like we do now? Is there one other thing, especially that IANPHI could do to in any way support your strategy processes, or how you are moving forward with the quite broad set of challenges we are moving ahead with now? No easy task on 30, now 15 seconds. But Igor, please, if I can ask you first.
I think that is future public health in our region is to connect neighbor countries in some kind of networks in different topics, non-communicable disease, communicable disease. And if you have that support from outside and support from inside, from your government, it is a good view in future. So for this problem with people who want to work in public health, we must use another model, because in my country, it's a small country, almost 700,000 people. and the Institute of Public Health is the only institution which mandate is prevention, control all disease and coordinate that process. Almost of that workers here they finished medicine faculty, but I think that we need to new model that we use some other workers who finished other faculty, somebody who maybe finish pharmaceutical, some biological, social medicine, or something like that. So in that way we will have more and more workers. So I think that fundings and financial support from government must be in any country. It's very important to us, especially in sub-regular level. We don't have in my country sub-national level, but many bigger country in this region have, and it's very important to sustainable in a longer period.
Thank you very much. And Dr. Viegas, can I ask you if you have one last point?
Yes, maybe just say that the collaboration is key for us. Having a network of collaborators have been key to support for any emergency response. It was for COVID like that, for Ebola, for Marburg. So collaboration to establish sequencing in country, collaboration to be able to prepare our own reagents. So collaboration is key, and we are very lucky to be part of this network. And thank you to IANPHI and also to all other collaborators. Thank you everyone.
Thank you very much. And Professor Ikram, any final point?
Yeah, thank you so much. I think it's that's already pointed out by Sophia. I mean, collaboration, then coordination, then cooperation, and then communication. I think we have all these C's together, and we have to work at the national level, at the regional level, and then at the global level. We have to join our strengths. We have to learn from each other, and only then we would be much more successful. Thank you so much, and thank you for providing this opportunity. It's been a great learning.
Thank you very much. And then we will end with you, Dr. Tam, if you may. Any final point, Teresa? What can we do together?
Well, just put enough plug for IANPHI, and I think maybe even having a shared repository of tools that could be helpful. I think your survey, for example, would be very interesting once you complete the report. I just found this type of webinar exchange is also very helpful.
Thank you very much. So we are over time, so I will not summarize in any way, just thank you very much, all the speakers, every one of you that joined, and of course the Secretariat that have organized this session. The plan is to then put a summary together with the recording on the IANPHI website in a couple of weeks, and then also we will work on this note that both will try at least to summarize the findings from the survey, together with capture at least some of the reflections that we have got along the way, including today. So thank you very much, and have a good day.
Thank you.